Hello and welcome to Volunteering SA and NT's Commonwealth Home Support Program Volunteer Podcast Series. My name's Sabina and I'll be hosting today's discussion. Before we begin, I'd like to acknowledge that we're recording today from the land of the Kaurna people, who are the traditional owners and custodians of the Adelaide Plains. I pay my respects to their deep and withstanding connection to the land, waters and community, which remains as significant today as it has been for thousands of years. I extend that respect to any First Nations people who may be listening today. This podcast is part of Volunteering SA and NT's Sector Support and Development for the Commonwealth Home Support Program, or CHISP as we like to call it. We hope that volunteer managers and coordinators working within CHISP programs will find some useful tips and insights that you can take with you into your own work. Today, as part of International Volunteer Managers Day, we wanted to look at wellbeing and how volunteer managers can look after their own wellbeing and help to make wellbeing a priority within their organisation. We're joined today by Kylie Cocks, the Acting Program Manager of Healthy Workplaces at Wellbeing SA. Thank you so much for joining us today, Kylie.
I'm really pleased to be here. Thank you for having me.
Lovely. Before we get started, could you tell us a little bit about the work you do through Healthy Workplaces at Wellbeing SA?
Yeah, so Wellbeing SA is a government agency that supports prevention health, really, preventative health. And my role as the program manager is to look after the Healthy Workplace strategy, where we are really trying to create healthy, safe and thriving workplaces and work environments across South Australia. And as program manager, a lot of my work is to do with partnerships and working with other key agencies to ensure that healthy workplace is on top of the agenda and bringing together that systems change. So we work quite closely with Return to Work SA, Safe Work SA, Department for Innovation, Skills and Science. We work also alongside other organisations such as Business SA, SA Unions, and the University and CWEX, all kind of part of this group of the Collaborative Partnership for Workplace Health and Wellbeing, trying to pull together this systems change and raise the importance of why creating a healthy workplace is important. So along with that job, I guess, is the building and developing of tools and resources and supports for workplace leaders to utilise. And when I say workplace leaders, I'm thinking of those people who have got the ability to advocate for change within a workplace and also for WHS, HR, organisational development. A lot of the time in smaller businesses, it's the business admin officer, but it's providing them with the capacity and support and resources that we know that are going to work well to create a healthy workplace environment.
Fantastic. So we're talking today about how volunteer managers can look after themselves, but what we hear a lot of from volunteer managers is that the stresses and challenges that they face are often things that feel outside of their control. So things like a lack of time, lack of resources, feeling overwhelmed or stressed or undervalued or underappreciated. So to start with, I wanted to ask you, what can volunteer managers do to support and advocate for a healthy workplace?
Yeah, great question. And those issues that are raised are relevant to a lot of different industries and businesses and organisations, really. In particular, the lack of resources, because we always can do more if we've got more in some ways, and you've got to work within the confines of what you've got. I'm just going to take a step back, if that's okay. And when we talk about a healthy workplace, we talk about not just it being a singular thing. We talk about it being a process of where it's important that we are engaging both high-level leadership, business owners, managers and employees and workers to continuously promote and protect worker health and wellbeing. So it's more of a change management process than an individual outcome. And everyone has got a role to play, whether that be a worker, an employee or a volunteer in this case, up until to the CE and the business owner. I also like to think of it as building a house in some ways. And so for volunteer managers, this might be useful for you to think of in terms of an analogy where we're building a house. And our bottom foundation is around leadership, commitment and support. So leadership for me can happen at any level, really, to be a leader. We've all got leadership qualities that we can bring out. But the leadership commitment and support is really around where is it valued within the organisation? Where is health and wellbeing valued in the organisation? Can you see it in your vision statement, your mission statement, your business plan? Where is it within your induction processes? Where is it in your retention and recruitment strategies? Where is it in your engagement? Where is it in your work health and safety? So it's more around that leadership commitment, and as individual leaders we can take responsibility by walking the talk. So it's important for us to be able to recognise as leaders us doing what we're expecting other people to do, not, what's that adage? Do as I say, not as I do. Yeah. And so the same goes in this aspect for wellbeing. So that's your bottom foundation, because if we don't have leadership commitment and support, it's really hard to move on to those next layers and levels. So for volunteer managers, if that's something that you require within your organisation, I would suggest that you could potentially look towards putting together a business case to heighten this to upper level management, how important it is for our organisation to ensure that health and wellbeing is on the agenda. We know it's going to decrease absenteeism, increase presenteeism, reduce injuries, employees will stay for longer. There is so many benefits now and a lot of evidence that points to us needing to look at this from a strategic perspective. So that's number one. That makes sense?
Yeah, absolutely. Yeah. And I just to jump in, I think it's particularly relevant for volunteer managers because getting volunteers to stick around in the long term is one of those challenges that they face, and creating a work environment that really prioritises feeling good, feeling healthy, feeling happy can be such a valuable strategy to keep your volunteers around for longer.
Yeah, exactly right. And, with that leadership commitment, if it's written down somewhere in some ways that this is what we can do to support your health and wellbeing, and this is how our organisation is prioritising it, definitely people will be more loyal and likely to stay. At the next kind of pillar, one side, the next side of the house, if you're visualising in this in your head, on the left-hand side is around knowing what the needs are. So assessing the needs of, in this case, your individual volunteers. You can do this at this local level, but looking at what is it that they need to help support their health and wellbeing. What's most of importance and relevance to them? Is it around having flexibility in their volunteering schedule? Is it that they actually want to have great supported networks and that's why they're volunteering in the first place? Is it because they're at a certain age demographic and they actually are looking for some extra support around how to stay healthy and well, whether it be youth or the older age group? So it's important to understand the needs of what's going on. And some of that data could also come through with when you're looking at if there's been any injuries or if you know that there's been complaints that are coming through, having a look at all of that data to understand what the needs are of your group, because we are very time poor and you can't do it all. And so by assessing the needs allows you then to prioritise and say, okay, we are going to concentrate on this element only because we know it's going to make the biggest difference.
Yeah, absolutely.
And some of those things that you can do quite easily is at either meetings with volunteers or when you're recruiting volunteers is to ask them what's most important for your health and wellbeing and what do you think we could do to support that? And that will give you some insights to what those components are as well. The other side, so we've got our left side now and now we're putting our right side of our house up, is around engagement and having people involved in this. So again, this comes down to a lot of the time I think is a good time management strategy because we don't have time to do it all. And this allows for you to pull in some champions and other people who really want to drive this and who are excited about this work. So this could be some of your volunteers themselves who say, I want to take the charge around health and wellbeing. You could set up a committee of health and wellbeing volunteers that are looking to support the action in this area. Or likewise, if it's not on the agenda within your organisation, your agency that you're working for, put health and wellbeing on the agenda and ask for there to potentially be a committee who works towards health and wellbeing. So they're sort of like the three foundational steps.
Yeah.
What do you think about that so far?
I think that is making a lot of sense. And it's, with so much of the work we do, it's all about having those sort of proactive, preemptive structures in place that make it so much easier when perhaps an issue comes up. A complaint from a volunteer, an issue you're facing personally. If you've got a really good leadership base, good, policies and processes in place, it can just make the whole thing go a lot smoother.
Correct.
Definitely.
Yeah. So that's right. Those three are the foundational steps. And then if we then think about the next top layer, which is kind of like a triangle, I guess, it's the roof structure. And we call this people, places and vision. And so on one side of the triangle is strategies and actions you can take towards people. So that is more taking that individual aspect of how can we support people's health and wellbeing. So this might be through information giving. It could be through activities that happen, like you might do some kind of program, like a 10,000 steps, or you might be pulling together to have a conversation around mental health. It's more of an awareness kind of raising. It's trying to nudge people into the right direction for positive health and wellbeing. So that's the individual people element. And then we also need to look at the place. And this is more about the workplace environment with which you're working. So for volunteers who may be going out on the road, that's really classified as their workspace and their work environment. So how can we ensure that that is as safe, as healthy as possible for them, to ensure that they don't feel like they're in an unsafe environment? Or if you've got volunteers working from home, what's their working from home setup? For those who might be in an office situation, it's looking at light and air conditioning and plants, like all those little elements of the physical environment that make a difference to how you feel about where you're working, and the way the work design is set up to ensure that the types of jobs and tasks you're undertaking also support positive health. So sometimes, again, that can be something as little as knowing what the task is that your workers are undertaking or your volunteers are undertaking, if it's lifting things in and out, and what's going to then be the best way or the best mechanism to support that. So they're not injuring themselves, but over time there's, fatigue and concerns coming in around that. And then the other one is what we call vision, and that's all related to the culture, the vision of the organisation, and the policies and practices that are in place. So like you said, if there are clear policies and ways for people to make complaints, if there's bullying and harassment policies in place, if there's a great code of conduct, is the organisation, I guess, has that culture of care for everybody across that organisation. To me, that sort of creates the house. And so from a volunteer manager's perspective, there's lots of little things across the way for them to be able to support in creating that healthy workplace environment.
Yeah, absolutely. It's something that they can implement within their own program and, within the volunteer team that they have reporting to them. But it's also something that they can advocate for to their leadership and say, I feel like my wellbeing and my team's wellbeing isn't a priority, or, could be more of a priority. And knowing that, that's something you can approach, and you can ask for improvements to be made or suggest improvements, or just ask for a bit of more attention to be paid to it. So
100% correct.
Yeah. Beautiful.
Being able to recognise those elements and lead up and lead out is certainly beneficial. And I'll just talk now around the Healthy Workplace service. So if there are volunteer managers out there who are like, I do need some help with this. I really would love my organisation to get involved in creating a healthy workplace and strategising this. You can contact the Healthy Workplace service, and we've got supports to help with that. So if someone's saying, I really want to put together a business case and present this to our management to let them know how important it is, the supports on the Healthy Workplaces webpage can help with that. As can coming in through the service for us to be able to support in that area as well.
Fantastic. And if you're watching this on our YouTube channel, you will find the link to the Healthy Workplaces website in the description, so you can go there right after this and check it out. If you're all right, we might then sort of zoom in a bit. As it's International Volunteer Managers Day, we want to focus in on their experience, and while they can advocate at an organisational level, look at those things that they can do for themselves to really take a moment aside from looking after everybody else and making sure their volunteers are having an amazing experience, how they can really focus in and do some things to look after their own well-being, both in and outside of the workplace. Would you have any suggestions?
Yeah, definitely. And the interesting thing is, we didn't even talk about this right at the start, is like that definition around well-being. That can mean so many different things to so many different people. It's quite a nebulous concept in some ways. So if we just break down that construct a little bit, because this is important from an individual's perspective, what does wellbeing mean to you? And that's one question you need to ask yourself as a volunteer manager. What does wellbeing mean to you? We quite often know that wellbeing is about physical wellbeing. So the things that you can do for physical wellbeing that we know is really important for us is exercise. That doesn't necessarily mean running a marathon. It could just be going for a half an hour walk in the morning. For me, it's riding my bike to work. When there's hardly time in life, you need to find those little incidental ways where you can put that physical activity in. But we do know the positive benefits of physical activity are really significant. The other component of that physical wellbeing is also around eating healthy as well. So making sure that we are fueling our bodies with good nutritious food and keeping hydrated and keeping enough water. Adequate sleep, something that is really quite significant in life. And I often say for those who are listening who have got children, you get them into a great sleep routine when they're young babies. We miss that as adults, and we need to bring that back into our lives as adults, making sure we're switching off our screens and we are relaxing and having downtime. We might be listening to a meditation, being in a dark room. So when we go to sleep, we know that it's ready for bedtime. And if you can, getting into bed at the same time every night so your body is ready and aware for that. So I think they're sort of the main things from that physical wellbeing perspective. There's also social wellbeing and the important aspects there around connecting with others. Like, we are totally social creatures most of the time. And it's about individual relationships with people and having those connections. Again, we find ourselves being too busy and we don't connect. So my challenge to those who are listening is this week, try and bring someone that you've had a connection with in the past that you haven't connected with in a long time, and they're constantly in the back of your head thinking, I really need to ring that aunt. I haven't spoken to her in 6 months. Or I'd love to catch up with my cousin again. Or I haven't spoken to my best friend for 6 months. Pick up that phone and give them a call, because that connection's really important. I think the connection in terms of volunteering itself is really important as well. So it'd be interesting to know how many volunteer managers are actually also volunteers generally with other things in the community. But we do find that element of giving is so important for our wellbeing. So for all the volunteers out there, they're gaining good wellbeing just from being a volunteer in the first place.
Yeah, absolutely. And sometimes I feel volunteer managers can almost be a step removed from that giving aspect, the sort of the behind the scenes of it. But can it be really valuable every now and then just to reconnect if you're not already, and just seeing in person the impact you're making, tagging along with one of your volunteers if they're visiting an older person in their own home, tag along for the afternoon, or, pop down to the choir that's going on and just really see in person the impact that's going on and the role that you're playing within it can just really make you reflect on your own value and the importance of your work as a volunteer manager.
Yeah, 100% true. And I guess what goes with that too is that setting and pursuing goals and being aligned with your values set is really important to wellbeing. So understanding what your strengths are and what your value sets are. So you may like to undertake a strengths-based online tool that you can do, or what your value set is, so you can ensure that what you're doing in life is aligned to your values, because that in its own right will also improve your wellbeing. And setting goals then allows you to work towards something. My favourite goals to set, of course, around when's my next holiday and setting goals to save towards that.
Yeah.
So we all love to have that time off.
Yeah, absolutely.
A couple of other things I think that come through when we're thinking about the 5 ways to wellbeing that come through there too is about taking notice. And we do know that practicing mindfulness is really well researched and evidence-based now, and there are a lot of online resources and tools to support that. And that could be as little as a couple of minutes a day, really, to practicing meditation as well. So definitely don't discount the value of mindfulness and being mindful about the activities you're taking every day. And we see that journal writing, gratitude writing is really important. I tend to kind of think at the last two things before I go to sleep at night time, what are the two things that I'm grateful for today? And it can change from being grateful for having a pen up until, grateful that the sun's come up today. It's just a good way to bring us back to earth around, who we are and where we are in this world. The other elements of wellbeing, if I'm just going to bring it back to this construction, I guess, of what wellbeing is about, is also that element of financial wellbeing, how that's affecting us at the moment as well. So there's some great statistics that has recently come out from Beyond Blue around financial pressures and financial wellbeing and how much that's impacting on individuals and people. So again, some really good resources and support that's out there. But that aspect of the stress around finances and life is really significant. And there's the Debt Australian hotline that can be there to support people through that. There's some really great online resources with Money Smart. So again, if that's something that is causing stress for yourself or your volunteers, really good to reach out to some of those resources. Some aspects of that is, we as Australians, we do tend to have this feeling of, there's someone off worse than me. I don't need that. There's always going to be someone worse. But I really just want to say, if you're at that point, just go for it, because the sooner you get onto it, the better. And we've heard that from the National Debt Prevention Line, that when people ring up, they are in so much debt, rather than be thinking about in the first place not being at debt, but they're financially stressed. And the strategies that they put in place to support are a lot different.
Yeah, absolutely.
Yeah.
I love that point that you don't need to wait until it's absolute, chaos and worst case scenario. If you're just not thriving, if you're not feeling, you feel like you could be feeling better in terms of the financial aspect, but also well-being in general, you don't need to wait till it's crisis stations. You can, if you're just feeling a little bit worse, than usual, or you feel like you don't have as many good days as you can remember having previously, like that's enough to take action, to seek support, to, maybe consult a healthcare professional, whatever you feel like is the right step for you. Don't wait. Seek help. You can always feel a little bit better.
100% agree. We do. We all wait back and think it's going to get better, it's going to get better. This is one of the other activities, and I'll ask all the listeners now to think about this. If I say to you now, what are the three most things in life that you value? I'm just going to give you a couple of seconds to think about that. Okay, I'm hoping you've got your three things there. And I'm going to nearly 100% say that out of those three, you're more than likely going to say you value your health, and you value your family, and you value work, and work in a very nebulous kind of area. So at least one of those would have been in your top three for 100%. And unfortunately, health is that one that we always put down the bottom. Like, we always leave it to the last minute. But it is significantly the most important, because if we don't have our health, everything else is more difficult to do.
Absolutely. Yeah. And I feel like in the same vein, sometimes mental health is a rung further down than physical health. And people think, well, I'm perfectly able, I'm able-bodied, I've not got any chronic illness, I should be on top of the world. But your mental health, it really doesn't depend on any of those factors. It can coexist with those things, but it can also exist all on its own. And that should be, again, if your mental health is not thriving, that impacts you across the board. In work, in your home life, trying to enjoy your free time. If you don't have that nice foundation of contentment and positive mental health, it can really impact you in every aspect of your life. So
yeah, certainly can. And so the things that we've spoken about today in terms of looking after your individual health and well-being, they're the ones that we know are really supportive around positive psychology and general health from a chronic disease perspective, which includes mental health. But that's not to say that you're not doing great in all those things, but you still might feel like you're struggling. That is where it's really important to seek some external help as well.
Yeah, absolutely. I feel like we have we could continue talking about this for hours because it's such a fascinating area, but I think already we've gotten some really valuable insights and advice for those listening, and we'll be sure to link some of those resources that Kylie mentioned, the Wellbeing SA website, the Healthy Workplaces website, where you can go and explore this a bit further and start to really reflect on your workplace wellbeing and your personal wellbeing. But we'll leave it there for today. So thank you so much, Kylie, for joining us and for sharing all your really valuable insights and advice. And happy International Volunteer Managers Day to all those listening. So make sure you take some time today, or really any day, to do something nice for yourself, to just take a moment to really look after your own wellbeing. We hope you enjoyed this second episode of the Volunteering SA&NT CHIST podcast series, and we look forward to bringing you the next episode soon. Bye for now.